Okay, good morning, family. How was your morning? Good. What's different today? What's different today? What gets you excited tomorrow? Tell me more. Okay, so let's settle down. So, sino ang gustong mag-conduct ng ating family business? Anyone who wants to volunteer? Anyone? Let's have a lady do it this time. IB, ikaw na nga.
Okay, sige. So, good morning, family. Wait lang, tignan natin ang ating kodigo. Sige, so, tignan natin ngayon, family, kung sino-sino sa family members ang may na-violate na house rules kahapon. So, una, yung nagawa ko. Yung hindi ko nagawa. Okay, okay. So, sino-sino sa family ang dito tayo sa nag-iwan ng mga gamit-gamit sa kanilang mga lamis table kahapon at hindi nag-ayos ng kanyang upuan.
At the back, please sit down.
Okay, wala siguro kasi sinong okay. Oh. Ay, tama na. Charger, okay. Okay, so merong isa sa ating family. Sino pa? Sino pa sa ating family member ang hindi organize ang kanyang table kahapon after ng sessions? Pati cheer po. Paki-alala lang, baka na-memory loss na dahil siya ang concern ngayon. Wala na? Okay. So, sino ang gustong sino ang gustong magbigay ng kanyang payo sa ating isang family member na hindi organized ang kanyang table kahapon? Volunteer. Kuya G.
Bago ang lahat, baka may nakapulot po ng sa iPhone charger ni Doktora. Sa sobrang makakalimutin na ni Doktora ngayon, pati yung charger po na nakinalat na dyan, nakalimutan niya. So, may ibang kumuha. So, pakibalik na lang po kung sakaling naitabi po natin. Baka hindi niyo po charger. Sorry. Pero Doktora, seriously, awareness lang talaga lagi pagdating sa mga gamit natin. Make sure na pagka tumatayo tayo, nailigpit na po natin lahat yung mga gamit. Okay.
highlight what's the underlying attitude. Alex.
Okay, thank you po, Kuya G. Thank you, Doc. Pwede na po kayong umupo. Okay, next na concern po natin family is sino-sino sa family ang gumamit ng kanyang cellphone habang si Doc Purpose ay nagle-lecture. Ako, grabe. Grabe kayo.
Okay, address the attitude, okay? In your elaboration.
Okay. So, sino sa family ang gustong mag-address ng ating concern? Okay. Okay, may nag-volunteer po si Doc Robin.
So, maraming gumamit ng cellphone Ngayon, ina natin yung refusal technique naman kung bakit or i-CBT natin sila. Sila naman ang pagsasalitain ko kung bakit nag-trigger yung nila, yung paggamit ng cellphone. Doktora, bakit ka nga pala gumamit ng cellphone? But ano yung cause ng nag-trigger sa'yo?
Look, we don't do that. Straight out, pangaral.
Ganun na. Sige.
Pwede ka mag-create,
Pwede
ng dissonance.
Sige. Yung mga gumagamit ng cellphone, siyempre, respect naman si Dr. Purpose para sa, habang nagsasalita siya. Disrespect kasi yung mga ganun. Parang hindi ka kasi nakikinig sa mga sa lecture niya kapag at saka hindi rin, siyempre si Doc, hindi niya naman alam kung naintindihan nyo or hindi nyo naintindihan yung lecture niya. Okay po.
Thank you po, Doc Robin. Thank you family sa pagiging honest. No? So malayo ang mararating ninyo dahil sa iyong honesty. Okay, so yan lang po family ang aking iko-concern or i-pull up kasi kailangan nating makarami. So yun lang po, Doc. Maraming salamat po.
Thank you. Amat? Okay, so how about giving an affirmation? Sino may affirmations for anyone or any group? Any affirmations? All right, Gilbert.
I want to affirm the whole group kasi kahapon parang first time na nakita kong maayos po talaga yung mga tables natin at saka mga chairs nung umalis. So sana panatilihan natin kahit nawala na tayo dito sa training. Sana yun yung maiiwang magandang takeaway natin sa ginawa natin. Sana maging regular na practice na natin yun.
Okay, sa affirmation, walang direction. No? You just affirm a person. That's it. No? Okay, walang pangaral. Okay. Any affirmation? Okay. Ladies first, Vincent. Go ahead.
Good morning, family. Gusto ko lang pong i-affirm si Ate Adeline, si Ate Abby, Apo. Ate Joanne, Dr. Ferda, Ruby, Kuya Ivan, mga ate and kuya, thank you po sa pag-share ng food. Thank you.
Okay. Thank you. Vincent.
So, maaari po bang tumayo si Kuya Raymin? Si Doc Franco? And then si Sir Ivan? And Sir Gilbert. So, ayun, gusto ko lang i-affirm yung ginagawa nyo during our sessions na nagtatanong-tanong kayo kay Dr. Faz. So, magitan nyo, natututo din kami. So, thank you.
Sino pa may affirmation? Anyone?
Kung meron dapat i-affirm dahil sa arami ng tanong, yung valedictorian natin, si Dr. Jilin po. Mas marami ako natutunan sa kakatanong niya. Ayun, mas marami po kang natutunan sa kakatanong niya. Dami yung tinatanong na very relevant sa program.
Okay. Yes, yes. Dr. Jalen, you always pay attention. In all the trainings I did, you always do. You're very consistent. Okay, you always pay attention. I appreciate that. Okay, sino pa po ang mayroong affirmation? Okay, Doc.
Dr. Robin, gusto ko i-affirm si Dr. Robin and then Sir Toto po. Tsaka yung passengers na nila. Ma'am Sayla, Ma'am Ann, yun. Sorry. Bale, gusto ko silang i-affirm, Doc, because dahil sa kanila, Doc, dahil sumasakay po kami sa kanila and then nakakapasok din kami on time dahil sa kanila. Thank you so much, Doc Robin and Sir Toto po. Katipid din po kami. Thank you.
That's a long commute. Okay, sino pa po ang mayroong affirmation? Okay, Dr. M.
Gusto ko lang i-affirm lahat ng nandito ngayon kasi kahit na buong araw tayong nagte-training, naisasabay natin yung work natin outside dito sa conference na to. Ayun po.
Okay, very good. Sino pa po? Mayroon pa ba? Okay, Ivan.
Gusto ko pong i-affirm sila Sir Toto at saka si Sir Raymin. Ayun. Ayun, dahil nag-volunteer sila kahapon for the role play even if it's hard to perform in front of the crowd, but they did it, so they were able to conquer their fear. Good job.
Okay, very good. Sino pa po? Wala na?
Good morning, family. Gusto ko pong i-affirm ang buong family. Kayo, dahil po sa gusto po namin kayong i-affirm in behalf of Sir Ivan sa pagiging mabuti niyo po sa amin sa mga pagkain sa tabi, sa mga sharings at learnings na dadalhin namin sa SOC Sergeant TRC. And of course, Dr. Ferb. Thank you, family.
Okay. Meron pa po? Okay. Very good. Thank you. That was a good one. Right? Okay. That's a nice way to start our day. Okay. So let's start our new topic today. We'll talk about different themes of relapse prevention. No? So there are actually, in this model, there are 12 themes. So I try my best to actually cover as many. I may not be able to cover all the 12. Pero kahapon, I covered just very quickly all the 12, no? Through sa lecture na yun. So now we'll focus a little bit more on some of them, okay? Sige, simula. Okay, ito ang una. No, in the 12 things, unahin natin to. Erroneous beliefs and perceptions about relapse. Okay. Ano yung mga maling paniniwala about relapse? Okay. Yung client, sa client, ito yung mga maling paniniwala. I'm a failure. There is nothing I can do. Di ba? Naririnig natin yan, no? Sa mga hindi ko talaga maiwasan, no? Ang aking paggamit. Ano pa? I can't tell anyone it's too embarrassing. No? Hindi. Mahirap ipagtapat ano talaga yung buhay ko, yung paggamit ko kasi nakakahiya. Di ba? Another one is since I sleep, there is no hope. So let me just go all the way. Yan, sa thinking nila ba, pag they had a lapse, right? Pick up sila, tumigil ng paggamit, nag-pick up, yun, nagiging hopeless na. Diba? So that is also erroneous thinking, no? Na dahil lang sa hopeless na siya, sige na lang, gagamit na lang. No? Okay, so that contributes to continuing drug use. Another one, I'm so ashamed and my counselor will be angry at me. Nag-pick up siya, no? So, sa isip niya, pag nagsabi siya sa counselor niya, magagalit yung counselor. No? So, at nahihiya siya. Ano ibig sabihin nun? Yung relationship niya sa counselor is what? Maybe the counselor is maybe not accepting. Diba? So, probably yung counselor communicates to him na you know, you cannot ever get high again. Para bang ganun? Ang message ba? Kasi pinaghirapan kita, marami akong oras na ginamit sa iyo, lahat ng effort ko sa iyo, you better not use again. Parang yun ba ang message, no? Oh. So ngayon, nag-pick up siya. So, hindi niya alam anong gagawin niya. Takot siya, magagalit yung counselor. Okay, so ano ang noon? Ano ang resulta noon? Di magsisunungaling na lang siya, di ba? O kung magtatapat man siya, ako konti lang naman po ang ginamit ko. Pero actually, hindi naman konti, di ba? So, hindi dapat ganun ang message, di ba? Sa kanila. Kasi totoo yan eh. Kahit na pinaghirapan mo ng todo-todo, yung isang residente, you'll never know, no? Malamang maggamit uli yan. Malamang. So, expect the worst, di ba? So, kung ikaw mismo ang na-disappoint, ano ibig sabihin noon? No? You're so disappointed, di ba? Doon sa client, na para bang pinersonal mo yung pagtulong sa kanya. Di ba? Pinersonal. Hindi dapat ganoon, no? Although talagang well-invested tayo, we should be able to kind of step back. Di ba? Yung tinatawag natin rational detachment. Remember, we learned that? Rational detachment. Kung may rational detachment tayo sa ating mga kliyente, we will not feel personally offended, right? If they make a mistake, like picking up drugs again. Kasi pag ganun ang relasyon mo sa kanya na kahit na hindi ba yung message mo sa kanya na nako, wag ka talaga magagamot, di ba ganun? Masisira ating relasyon. Hindi encouraging to the client to tell you the truth, no? Kasi hindi mo ang communication, ang kino-communicate mo sa kanya, hindi ka bukas sa pagkakamali niya. So sa ating mga residente, kasi yung chances of relapse is very high, we should communicate to them na, okay, we expect you, yun ang expectation, hindi ka gamit, pero pag nagkamali ka, you should be able to come to me and talk about it. Ganun dapat, no? Open ka sa possibility na magkamali siya. Okay? So again, wag mong personalize yung pagtulong mo sa kanya. Keep it professional all the time. No? Okay. If I share my thoughts or feelings of my urges, they'll think I'm a failure and I'm still weak. Right? So, for example, doon sa mga mag-aftercare na, yun maingat sila ng mga sasabihin sa iyo. Kasi ang tingin nila, baka mamaya i-hold back ako ba? No? Sa programa. So kahit na may mga nararamdaman siya na natetempt siya, may mga urges siya, hindi mo ma-explore kasi hindi niya sinasabi. Okay? Remember what I said yesterday na yung mental reservation na kahit na positibo yung residente, handa na siyang lumabas, may mga mental reservations pa rin yun ng paggamit ng gamot. No? So, kailangan ma-explore sa kanya yun. It gets very tough kasi pag malapit na siyang umalis, ano siya, nag-iingat ba? Baka mamaya ma-hold back siya. So, yung ingat niyang yun, lumalabas sa minimize niya yung problema niya, minimize niya yung urges, minimize niya yung reservation niya, di ba? Kailangan mapalabas natin yun. Okay? Di ba? So, yun, no? Lalabas yun. Depende sa relasyon mo sa kanya. Di ba? Kailangan, it requires really a high level of trust na kahit na ba may consequence na posible siyang i-hold back that he will actually talk about with you. Ganun, dapat katibay yung relasyon niya sa iyo. Di ba? Ano yun very sensitive yun to talk about, honestly, I'm not sure about alcohol. Dapat ganun mga conversation, di ba? Honestly, pag in-offer ako ng marijuana, I don't know. Hindi ko pa naisip yan eh. Di ba? Hindi ko naisip yan. Hindi ko naisip yung alcohol. Okay, inisip ko lang yung shabu. Kasi yun talaga ang nagpabagsak sa buhay ko. Okay? So yun, klaro sa akin yung shabu. Pero yung alcohol, hindi ako sigurado dyan. Ganun yung takbo ng utak ng ating mga residente. Di ba? Kahit ano yan, nasa aftercare na. Di ba? Ganun pa rin yan. Okay, so, but do you initiate the conversation about that? Whoever ever did that, explore with your resident what is his position about alcohol and the other soft drugs. Did anyone do that? Wala. Okay. Philip.
So, it's included in our CBT session yung topic na alcohol, argumento sa alak. So, nai-elicit namin yun, Doc, and nag-explore kami sa kung anong disposition nila towards doon sa kung babalik ba sila sa pag-inom or may chance ba na uminom sila. So, usually, Doc, matigas sila na hindi nila kayang iwanan. Kasi unang-una, the very reason is parang na-enculturate na kasi sa atin na kapag may okasyon sa Filipino setting, dapat may alak. So, yun yung bagay na parang nahihirapan sila.
Okay. So, good. I'm glad that you have that, no? Hindi lang alcohol, kundi yung mga soft drugs. Marijuana, some of them consider marijuana as not a big deal. No? It's not a big deal. So, if it comes their way, I might use it. So, don't stop with alcohol, but other substances other than hard drugs like shabu, heroin. Okay? Alright. So, dapat ganun yung discussion. Okay. So, culturally, justification yan, Philip. You understand? Justification. Kasi ang alcohol, kahit saan ka pumunta, present yan. No? Doon lang nga sa aeroplano, sumasakay ako, Anong gusto mo, sir? White wine? Red wine? Okay, di ba? Oh, sa US, ganun din. Thanksgiving, Christmas. Alright yan. Alcohol. You go to certain people like the Italians, right? Part of their meals, alcohol, wine. Okay, the fact is, regardless of cultural practice, would you risk your life? Would you risk your sobriety by trying and taking it, right? Yun dapat focus on that. The other thing, ang conversation would be, okay, so the way you handle yung drugs, for example, yung shabu, di ba? Nagka-problema ka dyan, no? Ibig sabihin noon, ang personality mo, pagdating na sa substances, hindi ka marunong mag-regulate. Hindi mo mare-regulate yan, no? Kasi tingnan mo, alam mo na nasira na yung buhay mo, di ba? Pero you cannot really handle it. Tuloy-tuloy pa rin, di ba? In some cases, yung tao na, in some cases, sira na yung buhay ko, I have to step back and whatever it takes for me, I have to stop using it. You're not capable of that. And accept that reality, no? Kasi hindi nila matanggap yun na gusto nila, come a time I can actually control. Yan ang thinking yan. I can control. Because nakikita niya, bakit yung mga ibang tao nakokontrol, ako hindi. Di ba? Siguro may diferensya sa akin. Ayaw niya tanggapin niya na posibleng iba siya sa ibang tao. Nakuha mo, ang tingin niya doon, dahil hindi niya makontrol, may diferensya siya. So, ipuprove niya na, wala akong diferensya, tulad din ako ibang tao. So, I'm gonna try my best to try and see if I can control it. That's a dangerous thinking. So, ikumpara mo yan sa diabetes. Some people are prone to diabetes, and so they cannot actually indulge too much in certain food. Yun ang reality noon. Some people are prone to hypertension. Di ba? Prone to hypertension. Ganun din yun. So, addiction to drugs is no different than some of the medical things. So, ikumpara nyo yun doon. No? Yung mga medical issues ng familiar sila doon kasi marami naman tao na may diabetes, may hypertension, which are actually controllable conditions. Di ba? In the same way, yung thinking mo na pwede mo i-normalize, hindi applicable sa iyo yun kasi may deficit yung sistema mo. So break it down to them in a way that they can really understand. Okay? Kasi hindi ka pagdating sa substances, yung katawan mo ibang response kaysa ibang tao. Hindi kaya niyan mag-moderation, no? Okay, pag gumamit ka, pagdating sa drugs, tuloy-tuloy yan. And you have to accept that reality. So once na-accept nila yun na, okay, that's one of the things that that's me, that's part of me. May i-process niya yun hanggang matanggap niya yun talagang. Ganun talaga yun. Madali na yung okay, alcohol. I cannot touch alcohol. Other drugs, I cannot touch other drugs because I have a tendency to overdo it. It's not them, it's their brain. It's just the way their brain works. Right? Okay, so, and yun ang dapat talagang i-explore, no? Bago sila lumabas. Kasi, ang nangyayari yan, pag hindi mo in-explore yun, tapos paglabas nila, tapos they start drinking, right? And then, little by little, kasi hindi na siya pwede gumamit ng shabu, right? Magko-compensate yung mind niya, yung isip niya na, okay, since hindi na ako makagamit ng shabu, ang aking enjoyment na lang is alcohol. Enjoyment is alcohol. Diba? Yun na lang ang gagamitin ko. But then, it will escalate. Kasi nga, sabi ko sa'yo, they don't know how to really moderate yung substances, diba? Mag-escalate yung alcohol use na yan. So, once that alcohol use escalates, ano mangyayari? He'll cross over to his favorite drug. Okay? He'll cross over. Una-una, yung judgment niya is faulty pag inom siya ng inom. Diba? Na-apektuhan na yung judgment niya. So, eventually gagamit. Ganun nangyayari sa yung mga dating nasa recovery and then started drinking alcohol. Many of them ended up doing that. Or, if they stayed with alcohol, they become alcoholics. They use it excessively. I can tell you many stories of people who actually ended up doing that from treatment. But back in the day, yung data, walang policy about alcohol. I'll tell you a crazy story about alcohol and the TC in data. DATAP is one of the oldest TC in the US, in New York. No? So, back in the, I would say, 70s, they realized that, many of the residents in treatment drink after the program. But at the time, heroin ang primary drugs nila, no? Heroin. So I'm thinking ng mga early people in TC na hindi naman the same category ang alcohol doon sa heroin. Di ba? So parang may tolerance into alcohol plus yung alcohol is socially acceptable. So it's hard to actually tell science that you cannot drink alcohol, right? Because it's legal, right? So what they did is there is something that called drinking privilege. This is a TC. So they allow residents to earn a drinking privilege. You know what is privilege? Crazy, right? Okay, so what they even do is yung mga residente na malapit ng lumabas, sinasama nila doon sa ibang older nasa re-entry na to actually see how they drink. But they drink. Okay? Tinitingnan nila, kaya ba niyong pigilin, gano'n-gano'n. Na ito ba, kaya niyong pigilin yung alcohol. That's what they did. And then after that, once they say, okay, you know, hindi man siya uminom ng excessive drinking, so, okay, may privilege ka na ngayon uminom. So they made it a privilege to drink. Okay? But down the road, they realized that many of these people who were actually ex-heroin addicts, who went through treatment, they end up using alcohol excessively. Some of them ended up having very bad liver. Some of them ended up dying because of alcohol. They realized that they were actually hurting their liver much later on. So many of these people eventually realized that I cannot go back to anything. I cannot drink because I tend to actually use it excessively. Some of them were smart enough to realize na hindi nila pwede pagpatuloy yun, pero mas masisira ang health nila. Pero yung iba, damage na yung liver. Because, you know why? Because when they were using heroin, it was already damaged to begin with. Na-apekto na yung liver nila. Many of heroin addicts have a very bad liver. And then they are given privilege to drink. It even made it worse, right? So many of them, they stop drinking, but they have very bad liver. So all their lives, they suffered from liver problems. Okay? But the damage was done. The other people, they were never able to actually stop drinking. They became alcoholics. You know what? You follow what I'm saying? So some of them, you know, later on they realized I cannot really touch any drugs because of my tendency is to use any substances in excess. Okay. So TC went through that process too. And it was terrible actually. The outcome of it. So, you know, we should learn from that lesson, right? That actually we have to train our clients to believe that they cannot touch any substance. It's not safe to touch any substances for them. It's risky, okay? Some people are able to, after treatment, are able to drink. You know, this is what I observed. If they have a long-term sobriety, matagal na silang normalize yung buhay nila, no? Normalize yung buhay nila. Some of them are able to drink but not do it in excess. But very rare. So, since some can and some cannot, you really don't know until you start doing it, until going back to drinking. So, my philosophy there is, don't touch it. Be safe. Don't touch it. You know, accept that you cannot because the possibility of you going back to alcohol is high. The other thing with that is like this. See, life is unpredictable. And moments in your life or history in your life, there will be moments in your life when you are actually high risk to using substances. For us, it's alcohol. Okay? So let's say you lost somebody. You're in recovery, right? You lost somebody. You stop drinking, you stop getting high. Right? And then you start drinking. Just to cope with the loss. You're very vulnerable at that point in time. Right? Psychologically, you're very vulnerable. What are the chances of you using that alcohol excessively to help you cope with the loss? Very high. Right? So before you know it, you're indulging in it excessively again. So life is like that, no? In critical times in our lives when we suffer some setbacks, like emotionally or psychological setback, that's a very vulnerable part of our time, no? Of our life. So if you're a recovering person and you use substances, you are most likely to overdo it. Okay? The other thing is, if you are using substances, very likely mataas ang tolerance mo for alcohol. you are an ex-user. You understand? Some of us, after 3 beers, that's it, right? If I drink more, I'll begin to feel different, no? I don't like the feeling. Some of us, 3 bottles, 4 bottles, we're drunk. Some people can drink forever. I'm telling you, I can drink a whole lot and still do not show, toxicity of alcohol. I'll give you another interesting example. A guy who I worked with was a bus driver for the New York Transit Authority. He was sent to us because he had an argument with a passenger while he was driving a truck. So he was reported by the passenger that he was, inappropriate in treating him. So he was asked to go down to the office to test alcohol. His alcohol level is so high that if actually that level is with some of us, we would be passed out. That's how much alcohol he had in his system. And yet he was driving the bus. And he did not get into trouble because of traffic. He just had an argument with the passenger. So when he came to us, I asked him, I said, how much alcohol did you have in your system? He said, I don't know. But I had a lot to drink. And he says, I can drink a lot, but I will not be like staggering all over the place. I can handle it. And this guy is just thinner than me, right? Small built. What does that tell you? His body can tolerate alcohol that much. However, he doesn't know, but it's eating up his liver. Right? You know why? Because the liver was overworking, trying to detoxify his body from too much alcohol, but he doesn't know it. So some of us are built like that, right? So this is a danger. That he is a dangerous alcoholic. Okay? My brother is one example of that. He has 1 beer, he is red all over. You have some of those? Yeah, 1 beer. He is so red. I said, wow, he cannot handle more than 1 bottle of beer. Okay? Both of that are signs that the body is not normal in processing alcohol. The excessive one and the one. It means, my brother's body is saying, alcohol is toxic to you. That's why he gets drunk. Well, maybe that's the body's way of preventing him from dying from alcohol. Okay, so he just drink one, and he's it. That's it. Okay, the opposite is true too. Some people can drink excessively and do not show, the adverse effects of alcohol. Okay, so this is a real story about the driver. So you don't know. It's hard to how people's body would process alcohol. But definitely, if you have been a drug dependent and you're dependent on one substance, that dependency can generalize to any substances. Okay? So we have to I guess, educate our clients, about alcohol, sell it to them. Because you're right. It is so accessible. It's not illegal. That it is very easy to actually rationalize the use of alcohol. Right? And then yung comparison. Okay, compare other people and say, hey, other people can drink and do not get into trouble. Why can't I? Big question for them. So break it down for them. Why? And don't ever try to see if you can handle it. Right? There's no need to do that. All right. Got it, guys? That's a tough situation, but I'm glad, in your intervention you have that. That's in many people who work in the field, they don't touch that. They don't talk about that. But that's very true. They are in a ambivalence. They're ambivalent about alcohol even when they are about ready to leave the program. So address the ambivalence about alcohol. Does that make sense? Yeah? Okay. All right. All right. Let's look at the counselor part. He's a hardcore. A common label that we give our clients. We look at the psychosocial, and it says they all started using drugs at the age of 13, marijuana, and then he has been using shabu for 15, 20 years, been in and out of prison, keeps going back to drugs. Oh, hardcore yan, hardcore. Right? Hardcore. I don't want that guy in my caseload. Hardcore yan. Alright. Right? Okay, so, kinahon mo na kaagad yung tao, nakita mo lang yung psychosocial. Di ba? Not a good practice, okay guys? So, imagine, nasa caseload mo yun. Di ba? Ang tingin mo sa kanya, hardcore to. Okay, so ito, nasa programa, he was doing okay, and then, he had a slip. At talagang hardcore ka. Di ba? Yeah. Avoid those kind of labels. They're not actually helpful at all. They're not helpful at all. Let me tell you this. People will surprise you, right? Sometimes tingin mo yung tao, mukhang itong tao to, walang ginawa sa buhay niya kundi maggamit. No? Hindi, tingin mo history niya, wow. Broken homes, di ba? Unemployed, and then out of prison, use a lot of drugs, di ba? Magiging pasawayan. Di ba? Pagpapasawayan sa loob. And then, all of a sudden, he responded to the program. He's doing okay. He was not a problem, right? Have you had a situation na kinahon mo siya, yung prejudice mo sa kanya, napakataas, tapos nag-respond sa program, nakakagulat, no? Ibang-iba yung expectation mo sa kanya. That's what I'm saying. People will surprise you. Another situation. This guy, comes from a good family, yeah? At least high school graduate, yeah? Only started using drugs in the last 5 years. Okay to, madaling hawakan to. Kamala-mala mo, isang muna maging pasaway dun sa loob. Have you heard those? In-expect mo na he will respond to the program better than the rest. Pero siya pang matigas ang ulo, ayaw sumunod. Di ba? Siya ang nabibigyan ng mga sakit sa ulo sa inyo. You have those? Na mali yung mo, wow. That's what I'm saying. Do not put people in a box. Okay? Because you'll never know. You will never know. The people whom we least expected that they will do well in the program, yung pamisa na lumalabas na maganda ang response sa programa. Okay, so, stop passing the judgment, right? Okay, wag mong kahunin. So, treat them like the same, because there is always human potential, di ba? Hindi mo alam what will trigger that human potential, what will trigger the resiliency, right? You'll never know. Maybe this guy who is hardcore, quote unquote, finally found a place now. I've been looking for this place to really get my life in order, right? So I'm gonna put this to good use. Maybe those are the people. Those people who are like, mga spoiled brat, di ba? Yun yung bibigay sa'yo ng sakit ng ulo. No? Na pagdating dito, very demanding, very entitled, question lahat. Di ba? You expect them to be more adjusted to the program, but they are the most maladjusted in the program. All right. Next is he's treatment resistant. Again, the same thing. He's treatment resistant. He was just asking questions. And then you already said treatment resistant. He's asking questions. Right? Okay. So, not a good label. No one should relapse. No one should relapse. You'll be surprised. No one should relapse. That's another expectation. Pinagdaanan nyo dito, we treated you very well, tinuruan ka ng maayos dito, and then, babalik mo pag, gagamit ka ulit. No. You cannot do that. Don't relapse. You disappoint or betrayed me. Oh, okay. So when you feel like somebody gets high and you feel like betrayed, you have to look at your relationship with your client. That is a dysfunctional relationship. If you feel that way. Diba? Pagkatapos ko siyang ganun, takbo. Binigyan ko siya ng mahalagang panahon. Okay? Nag-invest ako sa kanya. You had so much expectation. You over-identified with your client. That's what happened. And you over-identified like that. Mas masama pa yung loob mo at ikaw pa nasaktan kaysa sa kanya ng paggamit. Yeah, there is something wrong with that relationship. Okay? Take a look at that. All right, next. You better not relapse. Yeah? You better not relapse. Pag ganun ang ano niya, ang expectation mo, naku, mahirapan niya pag nag-relapse. Mahirapan niya magsabi sa inyo ng totoo. Ano ba talaga nangyari? You want a straight, honest story when they relapse. So you can help them avoid committing the same mistake next time. And you won't be able to do that unless they're totally honest about what happened. No? Don't even think about it. Alright? The same thing. Once and you are out of here. Okay, another one. We have zero tolerance for relapse. Same. You are non-compliant to our drug-free rules. Okay, all of that are like, what it does, all of that, communicates to the client, you better lie if you use drugs. Alright? And that's what's going to happen. They're not going to tell you the whole story, which is counterproductive. Okay. Erroneous beliefs, right? Both our clients and ourselves, we have some erroneous thinking with regards to recovery, especially relapse of clients. Okay? All right, cool. Questions before we move to the other thing? Dr. Lydia.
Doctor, with regards to the erroneous belief, no, what if you use that as a strategy to correct the client? Is it okay? Like for example, yung parang ipapa-feel mo sila na disappoint ka for doing that. Although you're not investing, parang iaano mo lang na gagamitin mo lang siya as a strategy.
Doc, you don't have, okay, Doc, you don't have to say that. They already feel that way. Kung mayroon kang matibay na relasyon dun sa residente, that's the first thing that they feel. I disappoint my counselor. So don't rub that in anymore. Yun na nga nararamdaman niya, di ba? So, okay, disappointed na siya. Kaya, pag minsan kinakastigo natin yung anak natin, nasasabihin niya yan. So, masama na rin ko, ma'am. Bakit mo na idiin? Di ba? Huwag mo na idiin. Ganyan na nararamdaman ko. Okay, hindi nakakatulong sa akin. Di ba? Marinig mo yan minsan. Pag, ikaw kasi ganyan. Di ba? Sinabi ko na sa'yo. Ganon. Di ba? Pag we reprimand our children. And then, they feel like, ma'am, alam ko, sorry. Ganun ta. Okay. Hindi productive, Doc. Pag you dwell on that. No? So, move it. Kasi, na siya eh. Bagsak na nga siya eh. So, now, ang tendency natin, let's lift it. No? Okay, Doc.
Doc, is it okay, kasi based from yung lecture niyo yesterday about role-playing, so is it okay if we could, yung latter part ng program, let's say, papunta na siya ng pre-release and matatapos na siya ng aftercare, we should have more of role-playing po. In that way, we are, in a way, nag-i-imprint tayo ng positive, sa kanila. I mean, na-exercise na nila yung sarili nila na this is actually the real scenario that they might be facing once they are outside. So I was thinking along that line po. And then another thing po, siguro Doc, we should practice using proper words. Kasi Doc, may nabasa kasi ako, yung let's say sabihin ko, don't think of a pink elephant. So at the back of your mind, you're thinking of the pink elephant. So if you're using that word now, you should not relapse. So at the back of their mind, they're already thinking of relapse. So why not reward it in such a way that the brain would not perceive it as something na kailangan ko siyang gawin. Parang may mga ganun po kasi ako nabasa, Doc.
Okay, so yeah, you're giving him ideas, in other words. Okay, so we don't use those words. Okay, that's my point. There's no need to use this word. Di ba, yung sa prevention, for example, di ba, before we used to tell them how horrible, dangerous drugs are. It creates the opposite effects. They get more curious. Right? The more dangerous it is, the more inviting for them. Adolescents. Kaya ko yan. Kaya ko yan. Sige, subukan nga natin. Ganon. Di ba? Opposite effect. Kaya sabi mo yung dangerous daw yung drugs. So, we changed that. That's a very old approach, by the way, of trying to prevent drug use. So, no. Okay. Yung sabi niyo, Doc, na role play, no? Na, pag nag-role-play, we're preparing them to possible actual scenarios sa labas. That's actually the whole idea. No? Kasi they found out that if they practice a behavior, right, when the actual situation arises, they're more likely to actually do it. Kasi na-practice niya na yun as opposed to you did not practice. That's the whole idea of role-play. You role-play mga scenario and how to respond to it. How what you say, how long you stay in that situation. Yeah. So if you can come up with a lot of those, you can develop like role play in all of those learning modules. Do it. It's the best tool that you could use. All right. Questions? Comments? Are we good? Yeah? Okay. So we move on to the next theme. Okay, next is helping clients identify high-risk relapse factors and develop strategies to deal with them. Okay, let's take a look at this. Alright, high-risk factors. Na-discuss na natin kahapon to. So, a form of review, no? Sa akin, repetition sometimes is good. So, it sticks to our brain. Okay, so you'll find some of the things familiar. Okay, put in different ways. Alright, high-risk factors are critical situations in which clients use alcohol or drugs prior to treatment. The factors usually involve intrapersonal and interpersonal. So, intra is external, enter is, within the person, internal, okay? The need to recognize the risk of relapse and high-risk factors as well as develop appropriate strategies to counter them are essential components of recovery, okay? All right. There are a variety of assessment strategies to identify high-risk factors or situations. All right, so let's look at those. Intrapersonal factors, interpersonal. Wait a minute. Mali yan Intrapersonal. Tama ba yan? Intrapersonal. Okay. Negative. Okay. Interpersonal. Okay. Yes. Yeah. Intra is internal, right? Yeah. Okay. Negative emotional states. High-risk factors. Remember we talked about that. Anger, resentments, and our clients have a lot of those. Yung anger na nakatago, no? Na they're still holding onto it, pero matagal na talaga nangyari. And it's common for people who have been emotionally and physically or sexually abused. They hold a lot of anger in them, All right, and those could be trigger, They ended up using substances. It can be triggering for them. Okay, anxiety, depression, frustration, boredom, they're associated with the highest rate of relapse. So the negative emotional states, we talked about that yesterday. That's, a common risk factors or high risk factors. Negative physical state. A chronic pain. Chronic pain is another one. Positive emotional states, celebrations, intense excitement. Okay, we spent some time talking about that. Huh? Testing one's personal control. Yan yung sinasabi ko. Using willpower to limit consumption. He wants to test his willpower. Okay, if he can use his willpower to limit use, that never worked. Okay, but they will say, I want to try and see. I've been drug free for 9 months. Okay, 9 months. So I can control this already. Okay, and then I'm gonna go out there, party, and I'm just gonna avoid using shabu. I'll drink very little. I'll be fine. That doesn't work. That is a setup. Urges and temptations. Okay? Those are high risk factors. The thing is, do not expose yourselves to situations that can elicit or illicit urges and you are tempted. Right? It's a setup. Again, clients say, okay, I'm going to go to a party and I'm going to use. I'm just going to test myself and see if I can handle it. Wrong. Okay, don't expose you because you understand cues and triggers. Yeah, those are powerful things. Your classical and operant conditioning will begin to, right? Yeah, cues. You go into a party. There are so many triggers, many cues there that reminds you of the past, right? So the risk of you picking up is very high in that kind of situation. Your mind changes depending on environmental factors. You know that, right? Yeah. They don't realize that. They don't know that. Your mind is gonna change. Your mindset is gonna change. Right now, you are in a safe environment. You're in a TC, right? So you don't think about getting high, right? Because it's a safe environment. There are no cues. There are no triggers in this environment, right? But when you walk into a bar or into a party, that's a different environment. Okay? Different environment. Your mindset also shifts in accordance with that environment. Okay? So now your mind is bombarded with so many cues, okay, and triggers, and then you begin to think, oh, maybe I can try a little bit. That's the beginning. Then, mamaya, okay, I've used already one. Siguro dagdagan ko lang ng konti. Okay pa naman eh. Makokontrol ko pa rin to. Okay, sige, one more. Alright? And then, wow, feels good. Okay, siguro, kaya ko pa rin to. Kasi aware naman ako sa nangyayari. Okay, take another one. That's what's gonna happen. Your mind keeps actually, because it's all bombarded with all of that, cues and conditioning. And then you begin to feel good, and then your mind shifts again and say, wow, this is good. I like this. And then you're into a big surprise. Interpersonal relationship in relation to other people, in relation to things outside of you, right? Situations involving another person or a group, okay? A group of people, such as an argument with a family, yep, or a loved one that results in negative feelings. Okay, in fights, common ano yan. It can be a really a higher situation, because it elicits a lot of negative emotions, and especially if it elicits a lot of very bad memories in your life, right? Fight with a family member, right? So that really becomes a very triggering situation for you to use. Social pressure, both direct and verbal, and non-verbal persuasion, and indirect pressure. Being around people who are drinking or using drugs. Okay, you're a recovering person, right? And then nobody knows that. You're working in a company, but you're a recovering person, right? Company and your boss says, "Oh, it's my birthday. I invite everybody to. It's my treat. Okay, it's my treat. We're gonna go to such and such place. We'll have a good time. All the drinks on me." What do? Recovering person. Do you go or not? Okay. Very likely you will go. You know why? It's my boss. I don't want to disappoint my boss. Now you're rationalizing it. Right? Good rationalization. Good excuse. It's my boss and it's his birthday. I want to get along well with my boss. Right? What's wrong with that? Right? Okay, so you go, right? Then you're back to that situation where, okay, I'm just going to go. I'm just going to eat. No? And then I'm just going to order Coke. Not Coke. Addicting din yan. Ano na lang, seltzer na lang. Seltzer na lang, ordering ko. Okay, so you go walking in there, right? You're enjoying the food. You're drinking seltzer or lemonade, right? And then your boss gives you a glass. What do you do now? Right? What do you do now? Are you gonna turn down the offer? Okay, and then your rationalization kicks in again. Your rationalization kicks in and it says, "This is my boss offering me a toast, right? Siguro mag-sip lang ako ng once just to satisfy him, right?" And then your boss says, "Oh, what do you call that? Bottoms up." Oh, now you are in trouble. Bottoms up. You know what I'm saying? First of all, you set yourself up by going and you rationalize it. Okay, so, right? You rationalize it. It's my boss' birthday. I have to get along with my boss. I'm going to just eat. And that was a setup, right? Okay. And that happens. Not exactly the same story, but similar. You find easy way to rationalize getting into a situation that could be very triggering. Positive emotional states arising from some type of interaction with others. Positive, no? You're so happy because you're with your friends. You're so happy, you're so excited. These are your tight friends. Okay? Unfortunately, always celebration ends up in drinking. Right? It's kind of good. Alcohol is very much part of parties. Right? Getting together. Tough. Right? It's a tough situation if you're a recovering person. Alright. Assessment strategies for identifying a high-risk factors or situation. Okay. Identify high-risk situations and coping problems through interview of clients, past lapse or relapse dreams and fantasies. Is a good way. Like you can find out actually their high-risk situations by just talking to them, by asking them, okay, let's talk about, when you were getting high. What usually precipitates you getting high? In what situation do you usually get high? Or what's your state mind usually are you happy? Are you sad? Or are you overtired when you use? So you can actually find out their high risk situation by just interviewing them. Okay. All right. So you want to find that out, right? One of the initial tasks for us when we are doing counseling or relapse prevention is to identify ano yung mga high risk factors nila. Okay? So remember, anong mga places? No? Even people. Who are the people that are likely to get high with? Usually friends. Particular friends, right? And where? Okay? And what state of mind? Client in outpatient program who are unable to sustain abstinence can self-monitor by observing drinking or drug use situation, emotions, and interpersonal factors associated with urges or substance use. Outpatient program. Okay, so it's outpatient, you will encounter this. Okay, first they will probably the drug because they are mandated, they'll give that up. But the alcohol is the thing. Because you saw an outpatient focus on alcohol. Because many of them don't even think about na yung drinking can lead to drug use. They don't think that way. Okay? So you want to explore that with a client, especially those who continually test positive. Ask them, is the drug use related to drinking? Baka mamaya, what actually initiates yung drug use is they are drinking first. Yeah? It's common. Yeah? Una-una, wala silang balak na gumamit. Walang balak gumamit ng shabu or hard drugs. Okay? Pero they were drinking. Okay? So, pero hindi nila makonect yun na yung pag inom-inom nila will lead into that. Hindi nila makonect pa yan kasi hindi nga nila alam. So, you wanna explore that. For people who continually test positive sa outpatient, explore alcohol. And very likely, they have been drinking before they actually pick up the drug. Okay, what happens if he's drinking, right? Wala siyang balak na gumamit, no? Kasi nasa outpatient na nga siya, no? Kaya lang, hindi niya ma-connect yung drinking at saka using drugs. So, ito mangyari, iinom siya kasama yung mga kaibigan niya or kahit na mag-isa siya. Pagdating mo ng after mga 3 bottles, impaired na yung judgment mo. Hindi ka na makagawa ng magandang desisyon. Hindi sila aware doon na, your thinking is faulty now because of alcohol. That's what happens a lot of times. So explore that possibility why they keep testing positive in outpatient. Explore alcohol. And that would be a good opening to begin to explore alcohol and substance and their drug use. Diba? Magandang opening yun. Okay. Use of self-report questionnaire to assess higher situation. Maraming mga self-report questionnaire. Sino yun? Someone's phone. Oh, outside. Alright. Ito yung inventories, no? Marami yan eh. Si Anis inventory of drinking situations. If you Google it, you might be able to actually download it. Try. You probably could download it. Okay? So these are actually classic inventories, no? Anis inventory of drug taking situation, dailies, identifying high-risk situations, Carol substance abuse check. Okay? Yeah. Gorski's high-risk situation list. Okay, Gorski. Yeah, he's well known in the alcohol recovery. He has written a lot of stuff. Gorski. Okay. All right. So try Googling them, and maybe you can download the form. Okay, and take a look at it and see if it's useful for you guys. Okay. Let's see. Okay. Let's do a 5-minute, okay, 10-minute practice. Okay. Think of things that, okay, so I know you're not using drugs. I hope so. Yeah, I know what you think. But pick something, no, not just drug. You can choose alcohol. You want to minimize your alcohol, right? It could be cigarettes, and you want to actually work on that. Okay, it could be working on your carbs, sugar, right? And that carbs and sugar. It could be anything, no? Okay, ano yung high-risk factor sa ano mo? Oh, okay, ano pang mga bisyo? Besides drugs? Huh? Oh, gaming, right? Okay, ano pa? Shopping. Oh, shopping. Okay. Food. No? Kasi may taas ang cholesterol mo, pero, ala, gusto mo yung bulaklak, sige lang. Okay. Anything, no? Anything that you actually know that you should not indulge, but it's hard for you not to do it, not to indulge. Anything. Okay? And ano usually yung sitwasyon na leads you to actually ended up, ano yung mga factors or situation? Okay? Ano yung difficulty? What are your struggles? Bakit, no? Bakit tuloy-tuloy yung gamit? Okay? So, we'll go in depth on those behavior. So, find a partner. I'm sure anybody will have something that he's struggling with, right? That's the assumption. Okay, get a partner and do that. Do that, okay? All right. So, 5 minutes. No, one. Okay, listen. 5 minutes. Okay, and then after 5 minutes, change role. Okay. All right. Let's do it. All right, you switch already, switch. Okay, time's up. Time's up. All right. How did that go? How did that go? How did that go? Ang title niyan, Passions and Obsessions. Ano yung mga passions and obsessions? Okay. How did that go? Were you able to identify your high risks factors, yung mga likely times, places that you will actually indulge in your obsession, in your passion. Okay. Example. Sino yung gusto magbigay ng example? Okay. Anyone? Things that you struggle, to contain or get a sense of control. Anyone? Anyone who wants to share? Ikaw, Doc, anong passions and obsession mo? Ganun ba yan?
Doc, siguro po, yung work ko, Doc. Tsaka coffee, Doc.
Work and coffee?
Apo.
Okay, so why is that?
Sometimes I feel, parang tired. Yes, Doc. Yes, I get exhausted and parang nafe-feel ko na minsan, Doc, yung nababurnout na ako. Si Doc KR pa.
Nilululong yung sarili niya sa trabaho.
Kasi, Doc, yun din yung gustong-gusto niyang gawin. That's why. Yun yung doon din siya nagpapasaya. Yun din ang papasaya sa kanya po. So, passion niya talaga yun, Doc. Oh my God. Di pwede sabihin. Sa amin na lang. Ni Doc, ang tinatakasan niya? Wala, Doc. Wala siyang tinatakasan. Wala po siyang tinatakasan. As far as I know. Baka hindi niya sinasabi sa akin. Wala, Doc.
Okay. Alright, work. Work. Okay. Sino naka-identify kay Dr. Joey na nalulung sa trabaho? Anyone na talagang naukol yung panahon mo dun sa trabaho? No? Sino pa yon? Meron pa? Wala na? Malalim yan, Doc. Okay. Sino pa? Sino pa gusto mag-share? Wala na? Naku. Maghanap na ako. Tony, meron kang struggle?
Yes, Doc. Bale, yun na rin po, Doc, yung pinanong ko sa inyo nung first week pa yata natin, Doc. So, I struggle with my Doc. Obvious naman sa weight ko. So, bale, pan po, Doc. Pag-uusap po namin ni Ma'am, bale, na-identify namin yung mga high-risk factor situations, Doc. So, nagsimula kasi ito, Doc, last year. So, doon sa internal factors, Doc, na-identify din po namin. Then, parang mula nun, Doc, parang nag-justify ako na, yun nga, kain. To cope with the situation. Tapos, dumating sa point, Doc, na mahirap nang gumalaw, Doc, at bumabalik na naman lahat yung mga negative na tulad ng Doc. Itong mga nakarang araw, Doc, talagang elevated BP ko. So, yun yung mga Doc, kung bakit nagko-contemplate na ulit ako, Doc, na i-reduce ang weight ko. Then, difficulty ko, Doc, is masarap talaga kumain, Doc. Pero, Doc, yung pinakamalaki pa rin, Doc, kasi na yes, Doc. Yes, Doc. Saka I try to rationalize, Doc, na parang Ito, parang, na-earn ko to, parang gano'n. Kain ako ngayon.
Alright, thank you, Tony. Okay, so, sino pa, no? Diba, kailangan yung awareness mo ma-sharpen. Ano ba yung mga high-risk factors ko? So, Tony, like emotional state, right? How about others? Emotional, situational. Karamihan, ano sa tingin nyo? Is it more emotional state than situational? Okay, situational, no? Yung sitwasyon. Yes. Ano yung example ng mga situational factors? Anong na-discover mo? Si Romel.
Doc, I don't usually drink alcohol. So, yun nga, situational. Katulad nung sa ano namin, convention ng Philippine College of Addiction Medicine. Paisa-isa pong lumalapit yung mga boss nung PICAM. Lahat sila may dalang alak. Doc, in-shot ka, inom ka. Inom ako. Hindi ko alam, ilan na ba yung nainom ko nun? Hindi. Hindi naman ako nilasing, Doc. Pero, kumbaga, first time ko uminom ng ganun karami na iba-ibang klase ng alak. Parang siyam yata na baso yata. Iba-iba may. Pinakahuli yung Hennessy. Pero, nag-start sa Black Label. Tapos bilang may iba na naman, may iba. Hindi ako makatanggi kasi puro mga bossing ng PICAM, ha? Inuwi mo, di ba? Sabi ko sa'yo, uwi mo eh. Sayang. First time namin nakatikim ng Hennessy. Ang sarap. Anyway. Ayun, Doc. First time ko nakatikim, Doc, kasi I don't spend on alcohol talaga. So, ayun, napakamahal na alcohol nun. Magkano ba yun, Robin? Magkano yung bote ng Hennessy na yun? Ayun, tinakas ni Robin from the convention. So, sabi ko sayang eh. Iniwan sa amin yung bote eh. So, ayun. Hindi ako makatanggi dun sa mga boss. Same with yung carb regulation ko. Minsan, yung sa sugar po. Kasi diabetic ako. So, minsan, tinatanggihan ko, ganyan. Pero pag yung mga boss ang tikman mo to, okay lang yan, Doc. Minsan lang naman. Kunyari, si Doc Cha, bigyan ako ng suman. Siyempre, kahit inaano ko yung sugar, nahiya akong tumanggi. So, parang social situation po. Andyan yata si Doc Cha.
Ginawa pa pang puser si Dr. Cha. I know. Okay. Yes, situational. Yes. Hindi ko alam, lakas pala yun. Sa PICAM, malakas pala naman. Anyway. Okay. Yes, no, yung situational, sometimes, example natin na, people na mahirap tanggihan ba? Di ba? Okay. Especially in our culture, no? Sa ating culture, malaki yung, people na mataas sa atin, malaki yung tingin natin, no? Na ayaw natin ma-disappoint. Okay. Sino pa gusto mag-share? Struggles, mga struggles natin, no? It could be anything. Sino yung may struggle with food because of either diabetes, or, weight problem, or hypertension, cholesterol. Sino yan? Food issues. Food. Raise your hands, mga food issues. Food issues. Maraming mga food issues, no? Yes. Okay. There you go. Okay, so, alright. So, yun ang no? I hope you learned something from identify yung high-risk factor. Personal high-risk factors. Okay, so, it's actually 9:35. So, we'll break from here and be back at 5 minutes past 10. Okay? Alright, enjoy your break. Thank you.